Hello, everyone. Today, our group will be presenting about health promotion across the lifespan, and our group will be focusing on the late adulthood, which is 65 and older. So, we're going to be going over a few topics. It's going to be Erickson's stages of development, identifying unique developmental population in our group, what type of communication is appropriate for our group, the health promotion issues that they deal with from day to day, and lastly, patient education topics. So the first topic is going to be given by Kelly and Christine.
On Erickson's theory of stages of development, the population would fall into the stage of maturity. The ego conflict for the age group is ego identity versus despair. And the ego identity includes the group reflecting on their life and all their choices they made throughout their life.
With the group of ego identity, they feel successful satisfaction of what they have accomplished in life and take death as an accomplishment of life. They take their past as a blessing and a wholesome experience. Some some of the older adults from that age group have a different feeling and opinion. They feeling despair and they regret certain life choices and they wish they could restart their life.
Identifying unique developmental populations of a late adulthood. So, what makes this group unique? Some of the options I gave were that the chronic conditions become very common and also limit the daily life. The major life transitions like retirement and loss that may affect emotional health. And then we have the gero transcendence, which is the shift in perspective in late life. And then we also have the growing desire to leave a legacy and share life experiences when we get to that point. And then finally, just the acceptance and the gratitude.
What methods of communication are most appropriate for your population? You want to make sure you introduce yourself and ask open-ended questions to build trust. You want to stand or sit in front of your patient to make them feel comfortable. And in case they need to read your lips, you want to speak slowly, loud, and clear. You want to use simple words just so they understand you. Make sure that there is proper lighting for the patient to see you. And you want to ask your patient to repeat important information to state understanding and comprehension.
Health promotion issues for older adults. I first put early detection of diseases, which includes screenings for hypertension, diabetes, and cancer. I put preventing falls, regular checkups, dental, eye, and hearing exams, improving nutrition, improving physical activity, and mental health disorders.
Okay, and then patient education topics. So fall prevention strategies at home and in healthcare facilities. Nurses can discuss the importance of good lighting, removing tripping hazards, and installing grab bars in bathrooms to reduce falls in the home. In healthcare facilities, this could be educating patients about their individual risk factors for falls and stressing the importance of using the call bell. Medication safety is important because polypharmacy is a leading cause of delirium in older adults. So nurses should educate patients about the importance of keeping a current list of medications that they take and what they take it for. Another topic is mental health and recognizing symptoms of depression, because this is often underdiagnosed in older adults, since symptoms of depression like decreased appetite, social isolation, and sleep issues can be considered normal as we age. It's also important to teach older adults the signs and symptoms of stroke, as well as their individual risk factors for strokes.
Thank you for listening to our PowerPoint, and thank you for letting us give you a little insight in our age group. Here we have our reference page. We mostly used our book, Fundamentals of Nursing, but we did look up a few articles on the internet and some from the CDC and from the Germana Library. And thank you again.